Thank you for all being here. I'm going to hand it over to you, Hugo, to get our last panel of the day underway.
Sure, thank you. Hello, everybody. I guess we sit between you and happy hour, so we'll just jump right to it. So let me advance a couple of the slides here. We're going to skip through, and obviously this is a very, very rich topic, but my name is Hugo Pizarro, and I'm the Senior Vice President and Chief Experience Officer at ArchCare. ArchCare is the continuing care community for the Archdiocese of New York, and we are a full-service system. We operate a number of nursing homes, home care, some health plans, a PACE program, and a bunch of other community programs. But I really want to get right to the panel discussion. First, who's controlling the slides? Anyone?
I think it's supposed to be Cece, but she's having to call in. She's having audio problems.
Oh, geez.
Oh, that's okay. Everybody, technology is great when it works, right? So a couple of things I want to leave the group with, and just I'll call it reflections as we go through our discussion. So 3 things to really take back and think about as you're listening to the panel, and also when the session is over. The first is everything that you heard today starts with the leadership. So the role we play as leaders in the diversity and inclusion journey is obviously the key, but it's a daily action, what you do every day. So again, think about that. The second is look at the current environment. And again, the current environment, there's a lot going on, and we're going to touch on that, and some of the panelists will touch on that. But looking not only internally, but also externally, and plan accordingly. You can't ignore what's going on externally. And then the third thing is the barriers. Make sure you're aware of the barriers, not just in yourself, but in your teams, identify them, and then take some sort of action. Okay, so again, some reflection as we go through our session. Let me introduce the panel, and we're going to go a little bit out of order if that's okay, because I think a few of our panelists have hard stops. So let's start with Robin Stone. Robin is the Senior Vice President of Research at Leading Age and also the co-director of the Leading Age LTSS Center at UMass Boston.
Thank you. It's great to be with you. I actually sat through the entire summit, and hopefully all of the people who are listening to us have sat through the entire summit, because everything that everybody said is some things that I would have already said. So I'm going to try to make this short and sweet, keep it to 5 minutes or less. There is no way that a leader cannot pay attention to the racial and ethnic inequities in our system. We are a microcosm of systemic racism in this country. Our sector is heavily undervalued. 60 to 80% of all the care is delivered by what I call professional caregivers. These are not direct care workers. They are professionals who have incredibly elaborate competencies that need to go way beyond respect. This is about a job that is a profession. And until we take these jobs seriously and recognize that we need to have pay, we need to have career ladders, we need to have professions that are actually developed within our sector, we will continue to be undervalued. And so, you know, the problem we have is with about a half of our frontline being non-white, this is a systemic problem because of the undervalue, and it just gets exacerbated over and over and over again. So one of my messages to leadership is we need to have a diverse upper management, mid-level management, and C-suite staff. There is no getting around it. You cannot have this kind of imbalance. As long as you continue to have this, I believe, and I'm a researcher who's been in thousands of nursing homes and home care settings over my 45-year career, a lot of the problems that we have and problems with quality have to do with systemic racism and the way that we have treated a frontline. I have had many staff tell me over the years they are in a plantation environment. When Maurice said that, I almost it just went, the hair on my back went up, because this is language that I have heard literally quoted by many, many professional caregivers that I have interviewed and done work with over the years. So from a leadership perspective, we must recognize, for incumbent workforce, we need to recognize that there is an imbalance. We have to have cultural humility in terms of understanding the systemic racism that keeps our frontline caregivers, our professionals, down. And we need to do something about it as providers, as leaders. In the longer term, we absolutely need to have staff at the mid-level management positions. Our frontline supervisors need to be as diverse as our frontline professionals. That means clinical staff, that means managerial staff, that means we have to be working internally, we have to be working with community colleges, with professional schools, with all the networks that Marvell talked about. This is a systemic problem that must be addressed. And I think we have an opportunity to turn things on its head, because we are such a microcosm of the problems in the United States. What a fantastic opportunity to do some things differently. Leaders need to develop diversity within their ranks. They need to recognize the diversity within their front line and address it, turn it on its head. We're not talking about just respect here for staff. We're talking about empowering staff to actually run teams. These are the folks that know everything about the people that we all care for. None of the rest of us do. So it is essential for us to turn these things on its head and to address the systemic racism that is in our sector. And finally, I would say that the issues around the disparities in nursing homes and residents in nursing homes is also a systemic problem. Most of it comes from the fact that these folks live in these communities. Redlining kept these folks in these communities for hundreds of years. And now they are going to the facilities that are in their communities. And we are not busing residents to wealthy communities like we did with kids when I was in high school. What we have to do is recognize that we need more investment in these inner city and rural and other communities, whereas there is a disproportionate amount of people of color who are at much, much higher risk. And COVID just showed this. This was happening way before. I've been doing this for 45 years and have hardly seen any change. So we need more investment, not less, in these environments. And we need to talk to our federal and state folks. We need to advocate for that. So as leaders, we are advocates. We are change agents for changing diversity in our upper management and C-suite. We are going to subscribe to cultural humility in terms of understanding how we do work redesign to empower frontline professionals and ensure that they have career pathways and the monetization of that with good wages and benefits. And I believe, quite honestly, if we work on this, we're going to have a healthier workplace, we're going to have better quality outcomes, and we will be an example of a sector that has taken on systemic racism at its base. And as I retire, I am extremely excited about seeing this happen. So thank you very much.
Thank you, Robin, very much. Unfortunately, we were going to ask questions after each panelist, but unfortunately, it's because of the shortness in terms of the time, we're going to move on to our next panelist. Deek Cato, who's the Chief Executive Officer at AG Roads, a nonprofit organization providing therapy and rehabilitation services, short-term recovery, and long-term care at 3 Metro Atlanta locations. Take it away, Deek.
Thank you, Hugo. So Hugo referenced the time. We are late. The first thing I'll say, we don't blame any of the Black people in the room for us being late. It may normally be the case, but today it is not. That's the first.
It is not.
It is not. The first thing I would say. Very happy to be here. Heard some great presentations today. Kind of change a little of what I wanted to talk about in particular after hearing Marvell speak. I think Marvell touched me in so many ways, not just for the truthfulness he said, but really he made me look at myself in a different scope and a lot of the opportunities that I have been given And I want to speak to that for the little time that we have. So AG Roads is a nonprofit provider out of Atlanta, Georgia. We are one of the oldest nonprofits in the state. We've been around for over 115 years. Definitely the oldest nursing home organization. So with age, we also bring a great legacy, but also a great baggage with us. We are a large enough organization. We have about 500 staff and about 100 contractual staff. And we serve a huge minority population, about close to 60% of our residents, and 90 plus of our staff. 90 plus percentage of our staff are minority populations. And I'll just say it, of that 90 plus, I would say 90 plus of that 90 plus are Black. It's just the reality of the demographic that we serve. I am happy and I am proud to be the first Black person to lead this organization of 115 years, which takes me back to Marvel's conversation, which I didn't plan to speak to. Even prior to that, I've been with the organization for 12 years, but been the CEO only for about 3 years. And even prior to that, I was the first Black person to be a senior manager of this organization of 115 plus years. So while we have come a long way, I think there is something very disconcerting with the fact that I am the first in these two categories. On the outside, anyone would look at our organization and say, well, great, this is a Black-led organization. But of my senior management staff, which accommodates about 20, I am the only Black person. So yes, we have come a long way. However, I would definitely point to the fact that from a senior management perspective, it is me and it is me only. I would also point to a board perspective. From a board perspective, our board has come a long way in a few years, but we still have a very overwhelmingly white board. And this is not representative of our staff. It's not representative of our population that we serve, the residents that we serve. Any organization, the leadership, the board should resemble the community that it serves. And our organization does not. Going back to some of what Marvel said again, I will say proudly that I now can say I was the or the benefactor of sponsorship by a white gentleman who served in that position before me, and right set of circumstances at the right time. He not only mentored me, he not only put me out there, but he put his neck out there and said, hey, I'm going to be leaving in a few years, and this is the most qualified person in the organization. Thankfully, at that time in the organization, we also had a board that was progressive. Larry Minix is one of the people on our board who understood that and pushed for me to be in this position. So I think a lot of our conversation around leadership is gonna stem on those points: sponsorship, mentorship, deliberateness, being comfortable having these uncomfortable conversations and understanding that that's just a fact of where we are today in society. And nursing homes, like Robin said so greatly, we are just a microcosm of what's going on all around us. So a lot of the data that we saw today, great data, nothing in that data shocked me, because it's what's going on around us in society. Whether you talk about it from a COVID perspective, from a infection rate perspective, from a nursing home quality perspective, it is a microcosm of that. So happy to be here, and hopefully we could spur more conversation around these points. Thank you.
Excellent. Thank you, Zeke. Let's move right along and go to Barbara McFadden. Barbara is the president and CEO of McFadden Associates, but Barbara was also president and CEO of a number of nursing homes. So Barbara, take it away.
Hi, good afternoon, everyone. And I'm glad that everyone stuck, the true New Yorkers, and we stuck to it, except for the person who's from Atlanta, Mr. Deek. I have just a couple of points to make, because I think most of what I would have wanted to say has already been said. I must, however, shout out kudos to our keynote speaker, our first panelist speaker, Dr. Hrabowski. I've heard him before in a different setting, and he was much more aware of what he spoke. But he's very frank and honest today, and I think that I enjoyed seeing that. And I think it has a lot to do with the fact that we are peers. He's 70 and I'm 73, and at this point, something happens. You become able to express yourself as you wish. I'm in an encore career, and I see that, Robin, I say to you, you spoke a word about retiring. There's no such thing as retirement. It's called encore career. It's an opportunity for us to make changes in the organizations that we've seen over all the years that we've put in. I've put in 50 years as a registered nurse, and then up the ladder to the C-suite. So I understand fully, oftentimes you are concerned about where you're going to be later on, and you don't want to step on too many toes. And I think, and don't just pass those few words. Many people who are in the audience on this panel understand, how am I going to stick my neck out to make things happen when I know that I may never get the advancement in this organization or to another? I may be tagged as the troublemaker or the person who won't fit in. I will say to you, there is a second chance, and maybe in your encore career, but in the same token, if you presently have a position, in a management position, whether it's manager, whether it's VP, or whether it's already to the C-suite within an organization, I would ask you to think of several things, and then I'll be finished. Number one, develop a working relationship with the people that you interact with. It means from the people who sweep the floor, to the people who make your appointments, to the people that you have lunch with. It's extremely important that you manifest and demonstrate that walk of inclusion. When you see a breach within the definition, and it's probably already in the philosophy of an organization, of inclusion, of diversity, it's, we all like to pass JCO, we all want to pass those kinds of inspections, looking at your EEO statistics. Let it manifest in your attitude, in your daily walk, that you are an inclusive individual. We heard that this morning from Dr. Hrabowski, that it's management. We heard that from Marvell, management. We heard it from Hugo just now, it's management. Walk and talk what you know is to be true, although you may not be able to articulate it in a manner in which you think it would be respectful and for them to move on with. The next thing is that our organizations allow us often the opportunity to link with the communities that we're in. Either it's through an event once a year to the community that we serve, or it's to a local school, in which you might, during the summer months or during the year, offer an opportunity for young people, diverse communities, to be able to come in. We're dealing with a term of diversity today, and this troubled me at the very beginning. Diversity, when I grew up as a colored child in South Carolina, then in the South Bronx, and then moved to Queens, diversity, especially in the 60s, was a Black-white issue. People of African descent and people of European descent who happened to be in America at the same time. Today, 2020, December 9th, diversity includes not only gender, it includes religion, sexual orientation, all of those, and I've forgotten one, please forgive me. It's the opportunity and the definition has broadened in such a way that those of us in traditional definition may feel that we have been walked over, we have been forgotten. I think I want to put that into the space in which we discuss, so that we know that we have on paper in many institutions and organizations a broad spectrum of the term diversity. Yet I want you to know those of us who are in the traditional definition don't want to be forgotten. But it does not say that an organization, nursing home or assisted living, cannot expand itself beyond its walls to the schools in the community. And how about celebrating, when we celebrate Nurses Week or we celebrate PT, let those celebrations reflect the people who work there. Let them be involved in the planning. Yes, we're talking about the boards. Boards are very difficult to dismantle. When I was on a board out here in Long Island to one of the Catholic hospitals, there are people who are on the board 20 and 30 years, and they, in essence, bequeath their seat to a family member or friend. And I can understand what Marvell talks about. So in that kind of environment, for those people who are on organizational boards, and realize it's time, if you've been on a board 15 years, you've been on it too long, it's time to move on and to allow someone else. And there are other ways within the structure of that non-for-profit organizations that allows you to do some things that are innovative. And because you've had the role of being a board member, you have clout. You have the ability to make many changes that you do. So I'll close by saying that to my peers who are out there who consider themselves either in traditional category of being a minority or part of the new definition, you're not off the hook. We cannot look for an organization or society to make the changes if you're not also going to be involved in making a change for yourself. Are you mentoring someone who either looks like you or is in the same category? Are you demonstrating for them and giving them a hand and direct them to reinforce their capabilities? Because there's one thing I want to let everyone know. Do not change the requirements because a person, it represents a member of a particular racial, ethnic, or gender community, that you want to make yourself look very, very good. You want to always see that the credentials, the capability of that individual is a high caliber. Because remember, we work in an organization that's highly regulated more than the aviation industry, but have the lousiest reputation in all of society. And that's all I'm about to say. And I say to everyone, I have had an exceptional day and I wish you the best. Thank you.
We can't hear you, Hugo. Hugo, you're on mute. We can't hear you. No, we can't hear you.
It looks like he's going to call back in on his telephone.
Yeah. Try to help move this along. I think, should we just ask the next speaker to speak?
Hi, good evening, everyone. My name is Shanoy Wellington. I am a licensed nursing home administrator and have been I've been in long-term care for over a decade. I have listened to the presenters today, and I've also listened to my peers just now. And some of what I was thinking of discussing today was already mentioned. However, there is one crucial element that I would like to discuss from my perspective. As a leader, we have to think about ourselves as leaders and how we lead and how we position people in leadership. And there is one word. I was recently appointed to the chair of the American College of Healthcare Administrators Diversity and Inclusion Committee as the chairperson. And one thing in our discussions that we have been talking about is unconscious bias. And the question I would like to pose to you, my peers, is, do you have any unconscious bias? Is that preventing you from moving or motivating others to higher levels within your organization? I apologize for the light. My apologies for that. The reason why I'm asking that question is, I was very fortunate when I studied in long-term care. I started off in the admissions office. I'm a naturalized American, so I was born somewhere else. And I was born in the island of Jamaica. In Jamaica, we have a diverse population. However, we did not see color. It wasn't Spanish, Black, Chinese, or African American. We were just people. Until I came here in this country, then the reality of race became at the forefront of things. It became an issue when I went to college. It became an issue when I had to do my internship to become an administrator. It became an issue when I needed a job as an administrator. So the question that I posed before, do you have any unconscious bias within that prevents you from promoting someone on your lower levels to the ranks in which they can definitely complete because they hold or possess the necessary qualifications to do so? The reason why I'm asking that question is because I don't think that many of us think about it in that way. We will say to ourselves, oh, I have Black people in my job, I hire Black people all the time, but can we do more? Is there more for us to do? And that's a question that we have to ask ourselves, because oftentimes we can do more, but it's those little biases that we have that we don't think that we have. For instance, as a Caribbean American, we view many in our culture or in our, there's a difference between African American and Caribbean American. So there may be an unconscious bias between the two groups. But if someone don't point it out to a white person, they just see Black people. But to an African American, you see Caribbean American, African American, meaning people from Africa who are Americans, people who are from other areas that are Americans. So I just wanted to kind of bring our awareness to that. Recently, we had a team building exercise and we read Caste, The Origins of Our Discontent. And that book brought us to a point where we had to look inside to see what we're doing as leaders and to see what we can do to eradicate systemic biases within ourselves and within our organization that we serve. So my challenge to everyone, you, my peers, is to see, and I know that Deke spoke about he being the first Black person in his role, and I have also served as the first Black person in other roles as well. In leadership, as an administrator, I have served as the first Black person as well in the facility in which I served. However, I believe that sometimes we have to take a deeper look. Are our biases preventing us from developing and cultivating practices or behaviors that can result in intentional diversity and inclusion within our facilities? Are we providing models for diversity and inclusion through our different training that we provide for our staff, different educational opportunities that we provide to our staff? Are we providing resources and tools that will ensure that the longevity of diversity and inclusion continues? It is important that we just don't speak about it in the moment like we are right now, but it's important that we put and implement strategies to allow this, this process to grow and to see each other as a person and see us and respect each other as CNA mentioned earlier, see each other for what we are worth. I believe that we are all, we have a lot of great individuals around us who can bring so much to the table if given the opportunity. I never thought I would be in the position that I am in right now. Never thought of it. However, others saw the potential that I had and gave me an opportunity to utilize that potential. Thank you.
Thank you. Can you hear me?
Yes.
Okay. Thank you for that. And I'm sorry, I lost audio, but I'm back. If we could just move very quickly to, we looked at 4 areas and we'll have a little bit of a discussion around them in terms of what we can do as leaders to influence change in diversity and inclusion. The first area is education. And you heard a lot at the opening session about the importance of education. You also heard that the long-term care workforce is very, very diverse at the frontline level, a little less diverse at the middle management level, and not very diverse at the senior level, or as Deke mentioned, at the board level. So my question to the panel, and we can start with Deke, is what role does education play in this such disparity in diversity among the workforce, and what can we do to improve that in long-term care?
Thank you, Hugo. I would definitely say education for me plays the critical role. I just listened to a lot of what Shinoy said, and it resonated with me because I, like her, am actually an immigrant as well. And listening to the earlier conversations about the statistics around immigrant populations working in long-term care is really drastic. I mean, you're looking at a quarter of the working population in those areas. And I would say the answer to a lot of that is education, making sure individuals are ready, prepared for when that opportunity comes. I have had in the last 2 years to make 2 major hires. One a chief operating hire. And it really pained me that there was no one of color in my organization that was prepared for those roles. There were people that applied, but they were not educated for the roles. They were not prepared for those roles from a leadership perspective. So a lot of what my D&I activities since that has been based solely on education. I want to make sure we have people of diverse backgrounds, of diverse heritage, prepared for those roles. And I think long-term care has done a horrible job of promoting people through the ranks without preparing them. We take a CNA who is a great person, great personality, and we make them a manager. We take a housekeeper who is a great person, great personality, we make them a manager, and we do not prepare them. We do not educate them. We do not put them in a position so that when that opportunity comes, not just do they know the job, but they're qualified to fall into that position. There's a bit of a gap here though, because again, listening to Marvell today, you know, that this is not something we can make up for quickly. We almost have to start with the newer folks coming in, because a lot of the education in long-term care comes down to qualification, whether it be an administrator's license, whether it be a LPN or RN license. But I think education is the key, and I'm glad you brought that up first, Hugo.
Thank you. Let's move quickly, if we could, to partnerships and sponsorships. Deke also mentioned that during his intro, but Barbara, if you can give an example, and I'll give a quick example in my organization. We partnered with the Hartford Institute of Geriatric Nursing, which is part of the NYU School of Nursing, and created an RN fellowship to take new RNs and train them in the work within the long-term care sector. A lot of those fellows, those RN fellows, were people of color and minorities. So mentors become such an important piece to growing that population that Deke just mentioned. So Barbara, the question is, describe how sponsorships and mentorships are used, or you've seen them used, and how do they promote mobility in the workplace?
Well, I have 2 specific instances. one that I used when I was director of what was called then patient care services, or the director of nursing. I knew that what was lacking, the problems that filtered up to me, that included personnel or breach of standards of practice, had a lot to do with education. So I partnered with St. Joseph's College in Brooklyn, and did two things. One, their students, the RN to BSN students, did their field work at the nursing home, which availed me of the opportunity to meet with the instructors. And then we partnered with the School of Nursing to help and to train, I shouldn't say no, educate my, I was lucky enough to have several RNs who were head nurses and my nurse managers to teach them how to do physical assessment. It's an area of study that you may not normally have in, because nursing, there are so many entry levels. That key toolkit we didn't have any access to it, and it wasn't demonstrated. So what was very good was that I had a very understanding administrator who agreed with me, because I could deliver an ROI, a return on his investment of paying for this. And that return on investment we had better charting, our MDSs were filled out much better, and we began way back then having reduced hospitalizations. So that's an actual program that I was engaged in the institution where I worked at that point in time. The second is an idea that I'm putting out into the universe, and I'm sharing it with as many people that will listen. New York now has 1 in 10 for RNs. Finally, after 50 years, American Nursing Association and various other esteemed organizational entities under the realm of nursing have been lobbying to have the entry credentials to become a registered nurse, that of being an RN. So New York finally passed this on, and it's now law as of 2017, that if you have been enrolled in a program by December of 2017, or you are already registered as a nurse in 2017, you would always maintain, you were grandfathered in and will retain the title of registered nurse. Going forward, however, those who enter as of January 1, 2018 into any nursing program, you now have 10 years for which you have to have a Bachelor of Science degree or higher. Otherwise, you will not be able to continue to register to submit your credentials for being registered to work as a registered nurse in New York State. Sounds dreadful, not really. I see this as an opportunity for a large union like 1199, which is in so many nursing homes, almost all nursing homes, to look at the opportunity to re-educate nurses who were LPNs, went to an RM program, all paid for by 1199's educational fund. But those people who did not pass the NCLEX and receive the designation of registered nurse, that we take those nurses and we re-educate them, tutor them, whatever it takes to allow them to go to the next level and become registered nurses. Yes, I know that we need administrators. I know that we need people who are CFOs, and we need assistant administrators. But I see this as an opportunity for us to improve the care at the bedside, on the unit, by educating those group of nurses. Now you say, well, Barbara, if you educate them, they're gone. They're out the door as soon as they get a license. That's possible, but I'm certainly sure that some details can be worked out. Would there be an obligation on the part of the nurse to stay within that organization so it isn't disruptive And I'm certainly sure if the income derived from improved documentation, reduction on your insurance premium, because you have less cases that are because I also do review medical records for many institutions when they have a deviation from standards of practice. So there's a return on your investment. So that's what I'm saying. Two things: union employees, and I see it institutional. Thank you.
Thank you, Barbara. We're going to move quickly here. So, Shanoy, this last question is for you, and it revolves around communication. So obviously, we all see and know and read what's going on. It's been a difficult few months. We had COVID. We had all the racial injustice that was going on. We had protests. We had riots. So, Shanoy, the question becomes, how do you suggest, what advice do you give that, and how to incorporate what's going on externally and include that in your communications to reassure your workforce that you are committed to diversity and inclusion efforts and inequalities in the workplace? You're on mute.
Thank you, Hugo. It is always a good idea to stay abreast of ongoing issues within our communities. After all, the workers that we have within our facilities, they don't live in the facility, they go back home to their communities. So it's very important that we as an organization or as leaders stay abreast of what is going on in and around us. It's also important that we stay abreast of all new laws, regulation that comes through the pipeline in terms of what changes that needs to be made as it affects us as leaders and the operation of the facility. But most importantly, it is imperative that as leaders, as we are seeing some of these issues going on across the country, and not only in this country, but also in other areas of the world where people are protesting injustices, that we have a conversation with our employees. It's important for their voices to be heard and their thoughts on the matter be heard. And where there are areas of doubt or fear of our thought processes are not clear, it is important for us to have informational session where we provide our staff with good, credible, and sound information. I believe that, and not just our workers, our patients as well, because as I believe Maurice said in his dialogue, that he felt, there are instances where he said he felt like his light was dimming, and I understood what he meant, about having that light dimmed, and it can mean many things. In our facilities, we can see the light dimming because, one, we have workers who are, as other speakers throughout the day have said, work so many jobs to, especially our frontline workers, our paraprofessionals, the CNAs in our nursing home, the HHAs or the PCAs that goes into the home. We see how difficult it is for them to even sustain their family. Many of these individuals have 2 or 3 jobs just to break even or just to keep their family afloat. So it's very important for us to have those difficult conversations with them to find out how you're doing, how you're making it out. And it's important for us to seek them out. Don't wait for them to come and ask, but seek them out. Take a valid interest in their affairs, because as leaders, if we take an interest in them, then they will take and do a better job for us because they know we care and support whatever they're doing. It's important that we become advocates within our communities, wherever our facilities are located. We know that change does not only start within the facility, but there are some changes that are made by regulatory officials. It's important that we become advocates and voices for our staff when we go to when the platform is open for us to have these conversations. Because although we're running a company, yes, but we have to look out for the best interest of our staff and of our residents, because as administrators, that's what we are responsible for. We're responsible for everyone that enters, work, visit our building. We are responsible. So it is important that we have clear lines of communication with all stakeholders, no matter who they are, no matter what level of services they provide, and no matter what lines of service we provide to them.
Thank you, Shanoy. And I'm sorry, we are out of time. I just want to share two quick things. The last area or section, really, we wanted to spend some time, which we don't have, on activities. So I'll just say quickly, my example, storytelling. It's such a critical part of learning, such a critical part of developing. Sharing stories serves as a reminder of hope. It serves as a reminder that you do and can belong. It serves as a reminder that if you see people that look like you do it, right, or succeed, that you can succeed. One thing we did at ArchCare, and again, the pandemic has changed our lives, but since we couldn't break bread together, since we couldn't have meals together, we decided to ask for recipes from people's backgrounds, from their heritage, from where they're from, and created a cookbook that then we could share with the rest of the community. That was a way to open dialogue, to share stories, and get people asking questions in terms of where people are from and what their beliefs are. Cece, if you can put up the very last slide. I want to end with a quote, and then I will let everyone go to the final closing session. Is there a way to get up that last slide? So I'll read the quote. The quote says, "Great leadership does not mean running away from reality. Sometimes the hard truth might just demoralize the company. But at other times, sharing difficulties can inspire people to take action that will make the situation better."
Thank you all very much. Thank you to our panel, and thank you
To Advancing Excellence. Have a good evening.
Thank you, everybody.
Thank you to the panel. Looking forward to tomorrow, the work group tomorrow. See you tomorrow afternoon, and have a good evening.
Thanks, everybody. Please go to the closing session now.